Greetings and welcome to my channel. Before we begin, please go ahead and click the like, subscribe, and notification bell. 6 early signs and symptoms of labor pain. We all know that labor is dubious, something very unexpected with a lot of surprises. You start to feel somewhat unsure and post for indications of labor as your due date arrives near. You might think with each spasm that you're having contractions, or have questions like, how would it be advisable for me to respond if the water breaks? Or, is my back aggravation an indication of labor? You may likewise have posed comparative inquiries of different moms and got various reactions for each inquiry. Nevertheless, there are a few marks of labor that you should know for sure. So, let's encounter 6 early signs and symptoms of labor pain. Make sure you like and share this video with your peers. The baby drops. When your body gets ready for labor, the baby might settle further into the pelvis, causing you to feel lighter. There will be diminished tension in the chest and midsection, hence causing you to inhale effectively and eat a full feast. Nonetheless, it doesn't imply that labor is close. It will require a couple of additional weeks. In addition, first-time mothers will have to ease up sooner than experienced mothers. Nesting. As the name proposes, nesting refers to the nurturing sense to construct a safe household for the child. During those long periods of windedness and shortcoming, you could unexpectedly feel vivacious to set up and set the house up, paint your child's room, or save the things prepared for them. It is deductively demonstrated that nesting happens in other warm-blooded animal species as well as in people. Cervical changes. The cervix is the launch of the uterus through which the child is conceived. All through the pregnancy, this opening is thick, shut but not expanded, pointed towards the back, and has a layer of bodily fluid which is a bodily fluid fitting to safeguard the child. The underneath changes to the cervix signal labor. The diminishing of the cervix means that the cervix starts to get thin and enlarged, demonstrating that the lower piece of the uterus is prepared for work. Moreover, the opening of the cervix during work or enlargement indicated that the cervix opens to around 10 centimeters not long before work. You may not be aware or notice the progressions to the cervix. The medical care supplier could check your cervix once you get close to the due date. Bloody show. As the progressions happen in the cervix, you will shed the bodily fluid or blood. It exists in a knot or is released for a couple of days. It is touched with brown, pink, or red blood and consequently alluded to as a horrendous blood show. This demonstrates that the labor is close. However, note that only a few out of every odd pregnant lady will have this symptom. On the off chance that you notice the blood show somewhere in the range of 32 and 34 weeks, you ought to call your PCP as it might be an indication of premature labor. Water breaking. This might be the most fearful thing for a lot of pregnant women, but it's better to understand the whole aspect of water breakage. An unconstrained burst of the layers or breaking of the waters is a major area of strength for labor. It happens when the amniotic sac bursts and the liquid spout out from the vagina. When the water breaks, you should quickly contact your doctor for further guidance. Diarrhea. During the beginning phase of labor, the body discharges prostaglandins, which relax the cervix. They additionally stimulate defecation, normally discharging the entrail to clear a path for the child. This is a clear sign as it helps clear out your stomach and stay away from any uneasiness during work. Side effects, for example, loose bowels are conventional and could happen during pregnancy. Accordingly, you don't need to overreact about them. In any case, if you notice more conspicuous signs, for example, water breaking, blood show, or continuous constrictions, it could imply that you're approaching your labor. This is the time you should definitely speak to your doctor.